So today's sort of presentation is a bit of a taste of the type of material covered in that blended learning course as well. So if you think that's in any way interesting to you, just please let IMAS know. Anyway, it's good to have you on the call, however many there are of you. I am confident that we have a lot of experience among us and expertise. I am by no means the repository of all of that, but I hope that the presentation will give you some food for thought and perhaps help you structure your own thinking around working with IMAS when you go out on assignments and potentially in your own organisations as well. I will use perhaps through the discussion one or two examples which will obviously be anonymised, and if you use your own, clearly we need to accept a clause of confidentiality, but be careful in terms of the way in which you share any examples in the Q&A at the end if you want to do that. I should also say that having been an independent consultant for nearly 20 years, more than 20 years, you're always learning. So there are many points of discussion in this which are still things that challenge me, and I find that I'm still learning about in new assignments. Every assignment seems to be different. I would say that my main background or my main focus of expertise, if there is some, would be in relational areas. So I particularly work in areas where there are difficulties in relationship. But one of the things that I'd be raising for you to think about is that rarely is there an assignment in which there aren't quite important and critical relationship challenges to work through. So we'll come back to that, I'm sure. But just to take you through an overview of the presentation, we're going to look at four key things. We're going to look at what your unique contribution is as a member of the NHS IMAS pool, to give you a framework for the consultancy process, and this is the one that we use in the course and is, if you like, best reflects the type of process that IMAS is committed to using. I then thought it'd be useful to raise some of the challenges that certainly I've encountered, and I would be by no means unsurprised if you encountered on your own assignments, which may create some interesting discussion for us. And then just very briefly, what help, support and development IMAS has to offer, and it may well be that our colleagues from IMAS want to say something at that point. Next slide, please. Okay, so your unique contribution. When you work for IMAS, it is different for a number of reasons. It's different because you have bought into a set of values that IMAS have developed. They're very straightforward, but they are ones that we need to think about, and we'll look at those in a bit more detail later. But essentially, you are signing up to accountability, probity, and openness, and that forms the overarching framework, if you like, in which you make your judgments and decisions when working with IMAS. But actually also working with IMAS is quite different from working as an employee in the NHS, or working for a private consultancy firm. And I guess for many of you, you will be used to working in the fairly typical hierarchies that we have in the NHS. And one of the things about working as a pool member is that you will be going in to do an assignment in a different role where you won't necessarily have that position power or that authority that is given to you by your line management role. And that can be quite challenging and quite a challenging transition where you're used to perhaps being able to exercise direct authority over a situation. You'll be much more in the space of influencing and working alongside others to persuade and cajole into working with you in a particular way. With regard to private consultancy, when I did the evaluation for IMAS early on, one of the things that came out very strongly from those I interviewed was they enjoyed and chose IMAS often because they felt that they could trust that those people working with IMAS were there not with a profit motive, but with a motive to help and support them to get the very best out of the problem they're facing and to move things on. And they also felt, therefore, that you were prepared to tailor and to listen and create solutions with them rather than perhaps come with your own package solution that you want to, I suppose, sell to them. There obviously is a place for private consultancy, but I think it's important to recognise that when working for NHS IMAS, the NHS bit at the beginning does matter to people. It also matters to people because they often feel that you come and can hit the ground running, that you have a good understanding of how the NHS works. Of course, none of us have an understanding of every nook and cranny of the NHS, but there is often the expectation and the hope that you will, for example, understand a little bit about the way in which the clinical professions work, for example, and or the interdependencies of different parts of a hospital or even sectors, and that they won't need to spend too long trying to explain all these things to you and repeat what they feel is perhaps wasting some of their time. So these are the sorts of things that make your contribution as an NHS IMAS consultant really important to other people. They also tend to hope and expect that you will be around to help achieve sustained change. And this is always a challenge for many of us, I think, and at what point do you withdraw from an assignment? And sometimes there is a degree of anxiety which we'll come on to about the point at which you do that and whether or not you have left in place the factors that are needed for that organisation to continue with sustained change. But I think there is a bit of a contrast that was made in the evaluations too, that with private consultancies sometimes they will either perpetuate their presence longer than is necessary or leave before it's helpful. And those are things that as NHS IMAS we try very hard not to do. We want them to be left happy that you have done all you can do and that they are now going to pick up the responsibility and move on. So that's a little bit about the unique contribution. If we then go on to a framework for the consultancy process, NHS IMAS does, behind its values, if you like, has developed a style of consultancy, which is in trade known as process consultancy, but perhaps more easily for us to use at the moment is collaborative consultancy. So the whole emphasis is on working in collaboration with the client. And whilst you may well have expertise and you may even have solutions that you think would fit nicely the issues that you're being asked to work on, the approach that we use in NHS IMAS is very much on collaborating with the client so that they take ownership and feel a sense of responsibility for the process and the outcome of the assignment. So with that in mind, we have developed a course which uses Stephen Coates' book as a broad framework, although we have adapted it. His book's called 7 C's of Consulting. I don't have shares in it, but I would suggest it is a very useful book if you're coming new to consultancy. I should say there are other products out there, I am sure. But this one, as you can see from the stages below, seems to mirror quite well the type of consultancy and the approach that NHS IMAS would like to use and, in a sense, is their brand. So as you can see, there are 7 steps in the consultancy framework. And what I'm very briefly going to do is take you through each of those and then take you back through those in terms of challenges that I have experienced at each step, and colleagues that I've worked with have also experienced. So if we take the organisation entry, first of all, the first stage, establishing your relationship, getting those right, sorry, I'm on the next slide. I do apologise, I've completely forgotten. If we just go back a slide onto the 7, I do apologise, IMAS. If I just take you through those 7 and then we'll look at the challenges. So the first one is establishing your relationships, organisational entry. The second, confirming a joint and underlying the joint diagnosis, because that's crucial for ownership. Building a solution together, again, crucial for ownership and for success, really, is that solution is not imposed, but is worked on together. Making change happen, that's perhaps the one that is most challenging. Ensuring sustainability, and then finally getting closure. So that is a broad process that you would expect most consultancy experiences to go through, and it's certainly a checklist that is worth looking at and ensuring that you have covered all those bases in one way or another. Next slide, please. So the most likely challenges. These are the sort of things that over the years I've come across, and I'm sure many of you will have as well. Starting right at the beginning, organisational entry and establishing relationships. These are obviously critical. Those first conversations, how you're introduced, how you create rapport and trust with key stakeholders is going to be crucial. It's crucial at several levels. You will have an actual contract that IMAS will be developing with you, and that will be something that's written and gets signed. But equally important is the psychological contract with the key client. What's the deal, really, between you and the client? What are they expecting? What can you deliver? Are you both on the same page with that? And making time to get that right is so important. Of course, in there are a number of other questions, like who the client actually is. And sometimes the example that I have got down here is one where my initial contact was with the medical director, who then passed me on to the divisional director, who then passed me on to a clinical lead. Now, which of those quite was the client, and or were all three, particularly if they didn't all agree with the diagnosis, is the sort of challenge you might hit very early on in an assignment, actually understanding how you manage that complexity of perception and relationship. There will be no doubt with an IMAS assignment, there will be a named client on the contract as far as IMAS is concerned, but once you get into the organisation, you may well have to juggle and look carefully at different perceptions and which expectations you can meet and so on. So organisation entry is a crucial stage, not to be skimmed over, as it were, but to be given proper time. Of course, you're not going to get everything tidied up on that first stage, and you'll be moving very quickly and probably in the same meeting on to confirming a joint diagnosis. There are lots of pressures at this stage. One pressure and one challenge is often to provide a quick fix, either because you have one, so you're putting yourself under pressure to say, I've got an answer for you, this is the one, but more often from the client themselves. They may well be under personal pressure from line managers, they may be under pressure from inspectors and so on, and you know that's very real and shouldn't be in a sense dismissed, but remembering equally that get the diagnosis right will make all the difference to the success of the project. So resisting that pressure and just creating enough space to properly understand the issues will be quite important. That isn't to say that their ideas and solutions won't be very useful and might even work, and they may well have something, and you may well have something, but it's how you go about introducing that from a basis of shared understanding. Another challenge is to remember to take account of all the elements, if you like, in the situation. So it's not just the job in hand, it's the people that are going to be needed to ensure that that task gets completed, and the context in which all this is happening. We've just said, you know, a lot of people are under enormous pressure in the NHS these days. You know, we have to take account of that. It may well be that the people you're working with are feeling stressed, tired, disenchanted, demoralised, or whatever. They may hopefully be feeling excited and enthused, and you can work from that. But bearing in mind, you need to take account of all of those three things. You also need to leave yourself scope for review. Don't box yourself in too early to a solution or a diagnosis, because you may well find that as issues emerge, you will need to revisit and review that. So boxing yourself in and making, if you like, promises or creating expectations that you then have to backtrack on isn't particularly helpful to yourself or the client. So leaving a bit of wiggle room is always important. You also need to think at this stage, and also at organisation entry, in fact throughout, not only the cultures of the culture of the organisation you are entering and how they handle certain types of work. So, for example, are they sort of very crisis-led? Are they very reactive? Are they sweep under the carpet type culture? Having a good understanding or a reasonable understanding of that will help you enormously. But also you need to be very self-aware about your own personal style and preferences. So, you know, some of us like to be right, some of us like to get excited, some of us get bored easily, some of us like to get control over things quickly, and so on. So being self-aware of the impact you are having on the conversations and the progress that you're making is going to be really important. And if you feel it's helpful, I certainly use a sort of co-coach stroke supervisor sometimes for more complex assignments to get that support and self-check, if you like. Next slide, please. Building a solution together. This can take time and patience, and this is always something that we have pressure on. So you need to be patient yourself, sometimes with yourself, and make sure that you are mixing, I guess, a bit of pragmatism with a bit of aspiration. It's something which is always a challenging balance to do, and not get into the situation of maybe cutting corners and therefore making it difficult to make a sustainable plan in the longer term, but recognising equally that one has to be quite pragmatic, and sometimes you will have to do things in a way that doesn't quite fit your view of how you'd like to do them. Another challenge there is that stakeholders disappear or arrive that you weren't aware of, and that you have to, or weren't necessarily very obvious to you. And so being prepared to always engage and build relationships sometimes very rapidly whilst on the project is going to be quite essential. And along with that, using your political skills to navigate some of the conflicts of interest that may arise either with an individual and or between individuals with different agendas. You must obviously also be aware of those people who are very unhappy with the way forward that is emerging, and find creative and positive ways of dealing with that, and recognising they might actually have a point, and certainly you may well need them, depending on how many there are and how powerful they are to be part of the change. So being alert to those sort of behaviours that are undermining progress, and finding positive ways of engaging with those people will be important. Coming on to making a change happen, again, a bit of self-awareness about your own preferences around change. Some of us are fixers. We want to get in there and just sort it out, and can get very frustrated and irritated and bored when things don't happen quickly, or that a solution that we think is obvious is not obvious to others. So you need to think about your own style and, if you like, manage that appropriately. Another challenge is sustaining that enthusiasm and commitment, particularly when difficulties arise. And this really goes back to square one and our building of relationships right at the beginning, because when difficulties arise, which they surely will, if the ownership isn't there, you'll find people will perhaps walk away or give up. And so that level of trust and commitment to the task and to you supporting people will be tested at those sort of times. Obviously, we all talk about having champions. Any consultancy assignment involves change, and we want champions to within the organisation that we can work alongside and we can hand over to. We all know that that isn't necessarily as easy as it sounds, and it's also not always easy to keep those people enthusiastic. They may with themselves be excited at the beginning of an assignment and then perhaps cool off a bit, something more interesting comes along, and so on. So working quite hard on keeping your champions with you and engaged will be important. You also, certainly a challenge I've come across, and I'm sure some of you have, where the organisation leadership and or culture is one that is in some ways undermining the change that they are asking for, or maybe inspectors are asking for. And that can be very tricky, depending on the quality of relationship you have with senior staff when you're doing an assignment, and access to them, to talk openly with them in an appropriate setting about the difficulties the organisation is creating, or the leadership style, or whatever it is creating for progress to take place. So obviously that is quite a big challenge. Next slide, please. Evidencing change. This is something that you can never leave too late. It's best to be thinking about what that evidence might look like from the beginning, and maybe discussing that as part of that initial conversation. It can be time-consuming if you're trying to catch up on this, and you're trying to find evidence going back in time. So what I certainly do is find it useful to keep a bit of a diary, if you like, of specific events and things that happen that, in my view, evidence progress, particularly when you're working, as I do, in relational areas. They can be particularly hard to evidence. Clearly, there are different types. There are qualitative and quantitative, and often the quantitative are easier to at least measure, even if they don't give us the results we'd like. But thinking around what are the qualitative measures that you might use, or evidence you might use early on with your client, can be very helpful, and often the most powerful evidence. So stories from people about changes in different ways that they've experienced the service, for example, can be very powerful, whether that's from staff or patients. Then finally, ensuring sustainability. This is often the bane of an external consultant's life, because at some point you have to walk away, and ideally what you have created with the client is a change that is sustainable, and the resources and the capacity and the interest and all of that is in place as you leave, and you can happily walk away proud of what you've done and pleased to see others have picked up the responsibility and ownership, and confident that things will continue to improve and develop and embed. But I'm sure you all know that that is often a very big challenge. And so for me, there are some things that I feel it's important to understand. I need to know what I can control and influence early on, and make sure that I am thinking about sustainability from the beginning. And yeah, okay, producing, if we can, some quick wins, but making the argument that that will not sustain the change long term. So being in early with those discussions about sustainability, and understanding the issues around control and influence, both of that you have and also perhaps your client has, that perhaps feeds into the discussion around the organisation's support. And also, another challenge can be for the client and for you is understanding that wider and longer term context. It's not always obvious or certain that things will continue in the way that you had hoped. And sometimes that's just one of life's blows, if you like, and sometimes it's something that you might have been able to do something about. But keeping one eye on that longer term context, what are some of the things going on in the trust, in the hospital, in the service that might impact on the changes you're bringing in, and either be able to put that into the mix while you are there, or at least support colleagues in thinking through how they will deal with that when it comes. And then finally, next slide, the challenges you're most likely to encounter in getting closure. And I think for me, this is more than anything is personal, because I think it can be very hard to let go sometimes of some assignments. And then there are other assignments where you wish you could have let go a long time ago. So actually judging the right time and getting the right closure can be very important. For me, when a project goes well, an assignment goes well, I have done a good handover. I'm confident in its sustainability and the commitment of those staff, and that makes it much easier for me to walk away. It's much harder to walk away, I think, when things haven't finished neatly and tidily, and you do have some concerns. And I think, from my point of view, what I try to do then is to be very open with the client, and in this case with NHS IMAS, about the concerns that I do have, and seek guidance really on what are the sort of handover documents that would help the client tackle those concerns as they go forward. I think this is a time when it's particularly useful to seek advice from NHS IMAS if you need it, to make sure that that closure is appropriate. I know NHS IMAS will also be in touch with the client to evaluate a project, so they will and should be aware of any issues that are outstanding at the point at which you may feel you need to leave the assignment. It can be hard for some of us who may have tidy minds to be leaving a project, not seeing it neatly packaged up. And of course, that's often the case. You have to find some other way of getting closure for yourself in your own mind. And there are a number of things you might do other than hand over documents. You might take one last walk around the hospital or whatever. It can be that if you don't get that closure, you can leave others stranded. It's really important that you do actually draw a line some way quite publicly about the end of the project. I know NHS IMAS will do that, but it's important for yourself as well. And then finally, one of the biggest challenges is making sure that the organisation supports any future work in that area and the embedding of any change. This can sometimes be a challenge when you have an organisation that is crisis-ridden and leaps from one crisis to another and looks for the quick fix and move on. So next slide, just to finish, and this is something that colleagues from NHS IMAS might want to add to in some way in the conversation. But you will get support, very good support from NHS IMAS is always there if you need it. They have a number of people they draw on, not just the staff in the office, but senior partners who have a lot of experience in this work. But they help you right from the beginning with the scoping of the assignments. They agree that and they confirm that both with yourself and with the client. And they're often there to help prevent mission creep, if you like, or scope creep that can start to happen. Always give them a ring if you're concerned that the boundaries of the assignment are getting very floppy or being stretched in directions that don't seem appropriate, or you haven't got the resource or the skill set. Then it's very important you talk to NHS IMAS and they will support you in working that through, and the client. They will also project and program manage and give you templates and tools to help you do that. And they offer a range of day-to-day support. So you should be able to, if you need it, seek out some coaching or mentoring support. And you always have a dedicated program manager. I think Janet's one who's on the call now, available to discuss any issues. I know Janet's leaving quite soon, but there are others in the team. But that you will have an assigned program manager who you can contact at any time. So that's really all I wanted to say. I hope that's been useful and given you a bit of an insight, particularly those of you who are thinking of, joining the pool or have just joined and haven't yet done assignments. And I'm sure there are some here who probably have done assignments and I hope recognise some of what I've said and may want to contribute some of their own thoughts now. So I'm going to hand back